What is that noise?
No, sound like a power stapler, a nail gun.
Is somebody at work while they're at work?
Actually, I think that was President Chavez working his keyboard. He uses the power stroke on that keyboard.
And President Chavez, we are live now.
Thank you, Mr. Everson. Commissioner Everson, you remember we used to have the old school typewriters in the Army. We had to use our muscles on our fingers to get the keys going.
Royal and Underwood.
All right. Greetings, everybody. We will call this Caddo Parish Commission meeting to session. This is our special meeting on August the 3rd. It's now 2:04. Of course, this is virtual. Mr. Everson, roll call, please.
Commissioner Hopkins.
Present.
Commissioner Johnson.
Present.
Commissioner Jackson. Commissioner Young.
Present.
Commissioner Burrell.
Present.
Commissioner Cawthorn.
Present.
Commissioner Gage Watts.
Present.
Thank you. Commissioner Taliaferro. I've seen him, but I can't hear him. Commissioner Atkins.
Present.
Commissioner Chavez.
Present.
Commissioner Lazarus. And Commissioner Epperson.
Present.
Okay, now we do have two commissioners that I heard maybe more in real life than over the Zoom chat, but both Taliaferro and Epperson, Taliaferro and Lazarus are in attendance, but for some reason I didn't hear them via Zoom. So I'm counting 11 present and 1 absent. Commissioner Jackson is the only one that I did not hear from. Is that correct?
Okay. Thank you, Mr. Everson. We'll start our invocation by Commissioner Young, and then we will have that followed with our Pledge of Allegiance by Commissioner Epperson.
Thank you, Mr. President. Please join me, if you'd like, in the Lord's Prayer. Our Father, which art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom, and the power, and the glory forever. Amen.
Amen. Amen.
If we could get the flag, we will all stand. As veterans and active military to render the standard salute. All others, hand across your heart. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Thank you, Commissioner Young. Thank you, Commissioner Everson. Mr. Everson, we move on to citizens' comments.
We have not received any citizens' comments for today's electronic agenda. However, I would be glad to share the phone number 318-226-6596 should anybody want to call in. I don't believe we have any callers on the line unless Deputy Nations has received one. Deputy Clerk Nations has received one in the last couple of seconds. But if y'all want to just allow a couple of minutes, that number is 318-226-6596.
Thank you, Mr. Everson. Likewise, I received no emails for citizens' comments either. We'll give it about 10 seconds and then we'll move along.
Okay, would you like to proceed to new business?
Absolutely.
Okay, the first item under new business is just the certificate of teleconference. I only mention this because it is a little different than the certificates of teleconference we have attached in the past. So for the record, this does reflect the recent changes to the public meetings law. So that there's a slight difference there, but it still requires no action on your part right now. That brings us to item 5.2, which is to authorize the introduction of ordinance number 5963 of 2020. An ordinance to set the general purpose and special purpose millages, providing for millage rate adjustments as allowed by Article 7, Section 23 of the Louisiana Constitution of 1974.
Move to
Louisiana.
advance to Thursday.
Second.
All right. I got a motion to advance by Commissioner Atkins, second by Commissioner
Burrell.
Got it?
Actually, Mr. Chairman,
Yes, sir.
if it is okay with you and the body, I'd like to englobe both item 5.2, 5.3, 5.4, and 5.5 and advance all of those to Thursday.
Second.
Okay.
Second.
I'd be happy to provide some commentary on that.
Absolutely. Thank you, Commissioner.
I didn't hear you, Mr. Chairman.
All right. We got a motion and a second. Commissioner Atkins would like to welcome back until Thursday. Commissioner Atkins would like to speak on that motion.
Yes, thank you, Mr. President. Many of you just came out of a Finance Committee meeting in which we discussed all four of these millages in some detail. The timber millage and the rail millage and the bond millage are all pretty standard stuff that happen each year, and many of those are already set by the State Tax Commission. The first one regarding, it's called millage taxes. In that case, we elected to adjust our millages slightly to maintain revenues at the same level that we had, roughly the same level as we had in 2019. That's it, Mr. President.
Thank you, Commissioner Atkins. I should know there are commissioners on the board, but did any of the commissioners want to waive and speak on this? I see none. Mr. Everett, roll call vote, please.
Commissioner Hopkins. Okay, I heard a yes. If that's incorrect, please let me know.
That is a yes.
Great. Commissioner Johnson.
Yes.
Thank you. Commissioner Jackson. Commissioner Young.
Yes.
Commissioner Burrell.
Yes.
Commissioner Cawthorn.
Yes.
Commissioner Gage-Watts.
Yes.
Commissioner Taliaferro.
Yes.
Commissioner Atkins.
Yes.
Commissioner Chavez.
Yes.
Commissioner Lazarus.
Yes.
And Commissioner Epperson.
Yes.
Thank you. That is 11 in support and 1 absent. That motion carries. And that brings us to the next item on the agenda is to authorize 5.6, authorize introduction of ordinance number 5967 of 2020. It's an ordinance amending the budget of estimated revenues and expenditures for the general fund for the year 2020 to provide an appropriation for COVID-19 testing sites and small business support by issuing COVID kits and to otherwise provide with respect thereto. There are several attachments, and if I could make sure and point out, there is a new attachment that is an update that's called COVID-19 updated budget that was added after the initial agenda.
Good
Chair will
evening.
entertain a motion. If not, we'll move along. Commissioner Cawthorn, I thought I heard you.
Yes, sir.
Okay, go ahead.
All right. Good evening, commissioners. What I'd like for you guys to do is I am going to make an amendment to the dollar amount that we're requesting for this particular ordinance. After a conversation with some fellow commissioners, there was some uncomfortability with the numbers we were using initially. And so in an effort to meet some middle ground, I have made some adjustments. Also, I have Dr. Chris Keble on the line with us from LSU. And in a conversation with another fellow commissioner, they felt that the need for testing need to be dictated by the market as opposed to fellow commissioners wanting to do such. So in an effort to describe this, I have Dr. Keble on the line. I want him to give an overview as it relates to the necessity for additional testing here in Caddo Parish. He's going to also update us with the trend as it relates to COVID-19. Are you there, Dr. Keble?
Yes, sir, I am. Thank you.
Okay.
Well, thank you all for the opportunity to visit with you here today. First, I'd like to say thank you for your previous support. As you all know, the initial support to do community testing was quite successful. We have essentially come to the end of the funds that were originally allotted to do that testing. And as Commissioner Cawthorn was telling everyone a moment ago, we've had a significant amount of community outreach. I should say that we also do nursing home testing in conjunction with LDH, but our community testing has been in conjunction with the Caddo Parish Commission. In terms of metrics, as was mentioned a moment ago, in our state, or excuse me, our region of the state in district or region 7 of LDH, we've done quite a good job at controlling the percent positivity in nursing homes. In fact, I gave this information to Chancellor Ghali that talked about it with the governor last Thursday. And right now in nursing homes, our percent positives is in the neighborhood of 2 to 3%, which is certainly well below the 5% that we strive to achieve. However, in the community, that actually is very different. The latest data that we have now doing well over several thousand tests in the community is that a percent positive of 15% and actually growing. So really the need is to do more community testing and to get into regions of the community that have not already been tested because as we know, this virus is highly contagious and really shows no signs of abating. So with that, I will stop, entertain any questions, and happy to provide answers or commentary on anything else.
Thank you, Dr. Kevel. Commissioner Cawthorn, you still have the floor. If not, Commissioner Hopkins is next.
Go ahead. I yield to Commissioner Hopkins.
All right, Commissioner Hopkins and then Burrell.
I just wanted to say to Commissioner Cawthorn and Jackson, I appreciate y'all looking at this and coming down on the budget. When I looked at it originally, I was a little concerned with the original number. But thank y'all for looking at it and coming back down to a reasonable number I think we all can live with.
Thank you, Commissioner Hopkins.
Yeah, I think he kind of cut out. Commissioner Burrell?
Commissioner Hopkins, are you finished?
Yes.
Is he finished?
All right, Commissioner Burrell, you have the floor.
Thank you, Mr. President. I'm always interested in the statistics that Dr. Kevel is presenting. I have not seen yet any of the numbers that he's quoting. In addition to the percentage of the penetration that we have in Caddo Parish of testing. Secondly, the disproportionate number of minorities that are being affected by this based on the overall number of cases that we have. Just information like that can give me a better feel for how we're spending the money, the results that we're getting from it. I have not seen any of that. Not that it's not there, it's just that I have not seen a report on any of that.
So thank you, Commissioner Burrell. As I think the whole commission knows, we provided a previous report, was an interim report, if you will, at the request of the commission that was a letter sent to Chancellor Ghali. We're happy to provide that report again, since there's been several weeks that have transpired and many other additional testing sites. I can tell you this, that we do have zip code data. We are in constant contact with Dr. Martha White, who's Region 7 Director here at the LDH, as well as with initiatives with OLHS and our partner with Oshner, so that we make sure that we identify as many different places and can spread the testing out as effectively as possible. But we're happy to provide any information that the commission would like.
Now, would that be peculiar to, with these results, be peculiar to just District 7 or Caddo?
So yeah, that's a great question. So everything that we have done in terms of the community outreach has focused on Caddo. and we can provide you all the information that we have regarding Caddo. We had, at the initial onset of this pandemic, worked with some of the FQHCs across North Louisiana because we have a very good relationship with multiple FQHCs. I'm sorry.
Okay.
So we have that information we can provide you from Caddo.
Okay, thank you.
And just to be clear, Commissioner Burrell, we're really taking due diligence and every care to make sure that the monies that are being utilized from what's been appropriated by this commission are being used in Caddo Parish.
Okay, thank you, Mr. President.
Thanks, Commissioner Burrell.
If I can interject just a second, Mr. Chairman.
Yes, sir.
On last Thursday, we were afforded the opportunity to having a meeting with Dr. Kelvin and some fellow commissioners and the administration. I don't know if he had the graphics that he presented to us in that meeting, but if not, I would ask him, he could forward it to us, forward it to administration. And that would also give Commissioner Burrell further insight into this process and the comments that Dr. Kelvin referred to earlier.
I would like to suggest also, Commissioner Carlton, since LSU Austin is in my district, I wouldn't mind be a part of those meetings if possible. That's where the testing is coming out of.
Okay. Okay. Not a problem.
Thank you.
All right. Thank you, Commissioner Cawthorn. Commissioner Atkins, I have next.
Thank you, Mr. President. Dr. Kevel, I'm just trying to get a better feel for how the money flows through from us to you all. And in particular, I mean, I've heard mentioned that these funds would likely be CARES Act reimbursable. And if that's true, why doesn't LSUHSC or some related body go straight to the CARES funding instead of coming through the parish, if you understand my question?
Mm-hmm. So I don't know that I'll be able to give you the granular details regarding the CARES Act funding. Most of the CARES Act funding was distributed to the state. It then distributes it down below there. So we're in constant contact with Capitol Hill and many of our lobbyists and legislators. And the reality is that's a state priority decision in terms of funding. I can say that we are working very carefully and very closely with LDH to make sure that the funds that are available for testing, say, for example, in other parishes besides Caddo Parish, are available so that we can go out there and do community testing. Given the fact that both Caddo and Bossier are backdoors, if you will, and backyards, we have tended to focus most of our efforts there. However, a lot of the funds that we actually have received from you all, from what I understand, would be eligible for the CARES Act. However, not being a commissioner, that's not within my wheelhouse or my purview to look at that. And we'd be happy to work with you all to figure out as many different ways as you would like to be able to pull down that money.
Well, I guess my question is, are you not able to get all the funding you need from CARES Act? What's the purpose of the dollars that come from the parish? Right.
We get money from various avenues. So it used to be at the very beginning, before CARES Act was inactivated and actually trickled down to the states, there wasn't any money available to do any testing. That's now begun to make its way down through the system. However, that's also controlled at a state level. And like I say, that's out of my wheelhouse to make those decisions. We can only ask, we can only request. And in fact, in conversations with Commissioner Jackson, I do think it would certainly be within the purview of this commission to make a concerted effort and make sure that you all or our region is getting the necessary dollars in a manner that's commensurate with our population. As for the spending of that money, our accounting group, in conjunction with Ms. Frazier and your accounting group, meet regularly to go over all of the expenditures so that they meet all of the requirements as dictated by the corporate endeavor agreement that we've executed with the commission.
Thank you. Thank you, Dr. Kevel. Quick question, Dr. Wilson, while I'll still have the floor. Dr. Wilson, do you feel that these funds will be CARES Act reimbursable?
Yes, sir, because they primarily go into COVID testing.
So we're basically just kind of fronting some money, kind of
Yes, sir.
speeding up some funding activity here.
Yes, sir.
Okay, thank you, sir. Thank you, Mr. Chairman. That's all I had.
Thanks, Commissioner.
Point
to have
of
Farrell.
information.
Yes, sir, Commissioner.
I thought that I had read through the CARES Act, Mr. President, that since it does come through the state, it's easy to go through government jurisdictions rather than private and nonprofits. Maybe that's another reason why it may be apropos for us to still maintain that relationship with them, because it's maybe easier to come through us from an accounting standpoint. Just a thought there.
That's a good question, Commissioner Burrell. Haley, can you research that in a moment, and I'll call on you after Taliaferro and Young. Commissioner Taliaferro, you have the floor.
Thank you, Mr. President. Doctor, I just have a couple of quick questions for you. You mentioned that that you are responsible for doing nursing home testing. Can you tell me what nursing homes or how many nursing homes you currently are testing, and are we responsible for the COVID testing in nursing homes and rehab facilities and so forth in Caddo Parish?
So to answer your last question first, no. The monies and the dollars coming from the Caddo Parish Commission is not involved in any of the nursing home testing. That is strictly and solely coming from LDH. To go to the second and third, or first and second question, I should say, we are testing all of the nursing homes. We've tested all of the nursing homes in Caddo Parish and continue to do that on a recurring basis, as well as all of the nursing homes in Region 7, as per the mandate from the governor to LDH.
Okay, thank you, sir. And if I understand it correctly, if I get tested today, how long is my test good for?
So your test is good for any, at that moment in time, to be quite frank. You could be tested right now and then it be negative, and then walk somewhere without a mask or protection and then get exposed to a sufficient amount of virus that may or may not infect you. But the reality is the level of knowledge about whether people are infected or not really is only determined and confirmed by testing on a frequent basis.
So the testing that we currently have funded in the past is typically only one person, one test, one day. Is that what I understand? Basically, if I test today, I could get it tomorrow, and then I have to get retested and retested and retested. Is that correct? If I'm understanding the virus correctly.
So in theory, that's possible. But the reality is the virus has an incubation period of anywhere between 3 to 5 days. So that if you got exposed to the virus today, you wouldn't automatically miraculously be positive tomorrow, because that's not the way the virus works. And so the reality is, in particular in nursing homes, we do have to do frequent testing, and the LDH is aware of that. So this is really what boils down to community and overall viral surveillance.
And speaking of nursing homes, wouldn't you agree that nursing homes, the infection rate of nursing homes is primarily with those employees actually bringing in, because most of the nursing homes, if not all, are on lockdown to prevent any further spread of COVID. I know that some nursing homes do not have any COVID, and they are definitely locked down and nobody gets in except for employees. So would it be the presumption that the employees are actually bringing the COVID into the nursing homes?
That certainly is a possibility, but there are multiple other ways that the virus could potentially enter in, that besides just the actual employees on a day-to-day basis, depending upon deliveries or the way that they handle other individuals entering into their facilities. I would not be aware of that.
I understand. And it's never been since March or since COVID has been basically ruining our lives. It's never been the goal to eradicate the virus. It's only been the goal initially to not overwhelm our hospital system with the number of cases. And of course, I'm a strong proponent of wearing my mask. If it means getting us back to business, I will wear my mask. I'm not a fan of wearing it outdoors, but if I come in close contact with someone, obviously I'm going to maintain my level of safe distancing. It says in the report here that I'm reading, it's 255 deaths in Caddo Parish. Do you have any data that says during the same period of time, how many deaths we experienced due to influenza or the common flu? And our majority of course, let me ask this a simpler way. Deaths regarding the common flu, did they primarily affect the people that are either aged or have pre-existing medical conditions as well as, or similar to the COVID?
So if I understand the question correctly, it's really about to what extent does the flu affect others, and are there similar demographics? And to answer that question without having data in front of me, in general, and this has been subject to peer review and multiple analyses by several different municipalities and cities, that the flu is, in terms of its infection capability, less or maybe not quite as infectious, if you will, as COVID-19 or SARS-CoV-2, and the pathology of the flu does affect equally both elderly as well as people middle-aged and younger kids. However, just similar to SARS-CoV-2, that does also have something to do with your immune system and immune status. The difference between this virus, such as SARS-CoV-2 and the flu, is that humanity has seen the flu. Humanity has not seen SARS-CoV-2. Humanity hasn't. The spike protein of this virus is highly unique. And in that regard, it ends up becoming a trigger, if you will, for the immune system that leads to many of the complications that I think everyone has heard about, including the cytokine storm, including the pneumonia, cardiovascular defects. So in that regard, it's very different from the flu.
Okay, and just one other thing, and I appreciate you taking the time with me to answer some of these simple questions, but these are the questions that even though we've gotten answers over and over again, they seem to continue to arise. Initially, or not initially, but initially, yes. Initially, we were told that this COVID actually can survive on surfaces, and then we were told it hangs in the air for approximately 16 hours. And then I didn't hear anything else about that hanging in the air for 16 hours. And maybe that number is not entirely correct. But if it does hang in the air for 16 hours and you're in an environment, would it also be able to survive on surfaces? And so do we have to walk that back as far as a misunderstanding on how the virus actually is either transmitted and or how long the duration of its vitality?
So I understand your question, and I do believe at the beginning of scientific studies regarding this virus, which the whole field, none of us ever had any data in this regard across the globe. We've become more and more refined in our understanding of how this virus spreads. It is droplet based without much doubt in that regard. I think the evidence is fairly overwhelming now in the community, scientific community. And there's even more and more evidence that's emerging demonstrating that it can also be aerosolized based, which means these are smaller droplets that can linger in the air for an extended period of time. To the extent of how long it lingers in the air depends upon the circulation and the environment that's there, depending upon whether it's a closed room or an open space. And then on top of that, the virus is just like, if you will, the common cold virus. It's part of that family. It's a coronavirus. So we know how the cold virus, if you will, survives when it's on something like glass versus metal versus an absorbent material like a paper towel. So it behaves very similarly in that regard. And once people understand that, which is sometimes daunting to understand, people are better prepared to be able to take precautions.
Okay, and Dr. Wilson, you still on?
Yes, sir, I am.
Okay, just a quick question on the reimbursement for dispersed funds regarding the CARES Act. Is this a will be or is this a may be reimbursed?
I think
Is there
thus far we have submitted requests for $770,000 and received that. We got notified that our second submittal was approved, and we have yet to submit for the $175,000 you all had applied for the first round of testing. And as soon as we get the necessary invoices and evidential proof, we'll be submitting that, and we think that will more than likely get funded. So anything related to the direct testing and the PEE type of expenditures, like the masks that you all allocated for us to go and buy more masks, we feel confident that we'll get reimbursed for those expenditures.
And I thank you, sir. Appreciate that.
Welcome, sir.
That's all from me, Mr. President. Thank you kindly.
Thanks, Commissioner Taliaferro. Next, I have Commissioner Young.
Thank you, Mr. President. I had a question for, I guess, Commissioner Cawthorn.
Yes, sir.
The COVID tests that are in the proposal, I wondered what proportion of the budget those are. Are those, do you have like an idea of how many COVID tests you want to give out and how much one costs? Sorry, not COVID tests, COVID kits.
When you talk about the swabs, the masks, the gloves, and the gowns?
I'm not sure. Well, so it says, does it say, is it still in the
supplies?
This is the, I'm talking about the COVID kits. Are they, so it says, the Caddo Parish Commission would like to provide COVID kits to small businesses, which will include non-contact thermometers, hand sanitizer, PPE, and plexiglass for register areas. Do you have an idea of how many COVID kits we'll end up doing?
At this juncture, with it being pared down, I'm not 100% sure. I'm not 100% sure what will be the number of kits that will be prepared.
Okay.
This was added to the budget initially because there was some concern about us assisting in reopening the economy, reopening the economy and supporting small businesses. But to answer your question directly, how many kits we're going to develop with that, I'm not 100% sure.
Okay. Did you have a number for when the budget was bigger? Was it going to be like 100 kits or 200 kits before you pared down the budget from the earlier figure?
Yeah, at 25,000 a pop in each one of these categories, I was basing it around 125, 150.
Okay. Okay, so it'd be maybe 40 kits.
Correct.
Okay, cool. Thank you.
All right.
That's all I have for now, Mr. President. Thank you.
Thanks, Commissioner Young. I have Commissioner Burrell and Commissioner Atkins next. However, this will be second time speaking. I wanted to interject a couple if I could. One of the questions, and it's always confusing to me on the Ochsner LSU scenario, but to Mr. Kevel, is LSU, is the company that you work for, is it the state of Louisiana's university? Okay, and so my question is, could the state allocate the funds to pay for testing in North Louisiana via the LSU Health Center?
No, sir, they cannot. So the funds from the university itself doesn't have funds to do the testing, nor will they actually get money through the legislature to do this testing. And in fact, the LSU system as a whole is endeavoring upon a return to school or return to campus plan that they themselves, which involves all of our campuses in the LSU system, that they themselves are having to go to both the legislature and the governor to seek financial support for that. because there are no other funds.
That makes sense. There was a couple things. I applaud Commissioner Cawthorn and Jackson for thinking about the small businesses. One thing I know Crystal Grinley put out on Friday was the Louisiana Main Street Recovery $15,000 grant, which will cover for free a lot of this information that's in here, or a lot of this equipment. So I wanted to make sure that the state was, or at least the parish, was advised of that. I know Crystal put that out there. So that's one thing that, commissioners, if we haven't considered yet, the state is funding $15,000 per small business. So although I know we have a lot of.
Not doing that.
Let me chime in on that also.
Sure.
Not doing that.
So as it relates to that particular program, it's up to $15,000, and the majority of that money, with my understanding of the program and review of the program, is going to be replacement of income and replacement of payroll. So let's just say if you're a company, and if you are a company, and through COVID you had to spend $30,000 in payroll, well, you're only getting $15,000 back. Secondly, that program has two options. You can itemize your expenses to get up to the $15,000, or you can do what is called a quick release. Quick release. You don't itemize, and they automatically send you up to $5,000. So the point I'm driving is that, yes, it's another opportunity that does exist, but this right here with the small business efforts is a mechanism where we, as the parish, can assist these businesses when most people are more concerned about the replacement of that income and payroll. This right here will be an augmentation to assisting them with some of the things that they need with plexiglass and signage and that sort of thing. So I'm just trying to give conflation to the way the program works and what we're trying to do in assisting small businesses. And as you know, as this economy begins to falter with layoffs with the boats, and particularly Libby Glass leaving here, fortifying our small business is going to be most paramount as we go through the end of the year.
I completely agree. There's another thing I asked Crystal to put out there. She's going to post that today. We've been fortunate enough for a company called Compliance Learning Solutions. They have offered us for free a way to disseminate information down to employees. So employers can give their employees an online class for certification so they can show that they're certified in handling COVID scenarios. Crystal will put that out later. It's really cool. It's going to show employees the safety precautions. But one additional thing, and Vice President and myself, and as long as Haley and Miss Bryant are meeting a consultant out of South Louisiana tomorrow, they're going to show us how on the CARES Act to maximize the rate of return. We have about 12.1 million that we have unaccounted for. And what this consultant told me, we met last week, he said there's a lot of things that we've already done at the courthouse and at juvenile services, which we have a deficit, that he could show us how to gain some of that $12.1 million and not have to spend any additional funds. So that's one thing that I'll report to you guys tomorrow after we meet that I'll be excited to see is if we can actually save some money in our current budget and not have to come out of pocket on any additional spending. So stay tuned for that. I'll let you know how the meeting goes tomorrow with the Vice President, myself, and Ms. Bryant. Next I have on the list is Commissioner Burrell, and I know Haley is still standing by to answer your question.
I haven't spoke for the first time. This is Jackson.
I'm sorry, Commissioner Jackson. I don't show your hand up. Commissioner Burrell and Commissioner Atkins, hang tight one moment. Let me let Commissioner Jackson speak.
Yeah, I don't know how to raise a hand from the phone. I'm just gonna comment that, and I'll send it in an email. The CARES Act dollars are there for Caddo Parish being in reimbursement and expenses that we have had to deal with directly related to COVID-19. And I hope that we would not sit back and kind of advocate our responsibility or sit back and wonder. The Caddo Parish has $30+ million worth of unencumbered revenue. That's not to say that we should go spend it all every time we turn around, every single idea that we have. We're not asking anybody to do that. But we do not make a claim for the resources, the reasonable and expected resources that we have to COVID-19. We're going to be asking residents again in November to renew a public health millage. If we sit back and say, oh, that's not our responsibility, oh, that's the state's responsibility, that's the city's responsibility, how can we go and ask residents to say, entrust us with your public health tax money when we would have sat back and said, we're going to punt when there's a public health crisis that is declared and going on. I'm not here to argue against science. I'm not here to argue against things that other people have put out that has led to misinformation and hysteria. We have always tried to follow the facts. Even with so much misinformation being put out, we have always relied on Dr. Gollett, Dr. Kelville, the team at Ochsner's, the team at Willis-Knighton, Dr. Martha White. We've always looked to our local subject matter experts to guide us in our decision making. And I looked at this proposal, and it basically asks us to put up the cost of continuing testing. There's some cost in there for business expenses to be able to respond to COVID. All businesses will not receive Main Street money. There are some businesses that are not going to make it. The treasurer has already noted that there's not nearly enough money set aside in that fund to be able to do what needs to be done. And so everybody won't be able to get a piece of that. You also have this issue of if they have a physical location. What about people who may be a plumber that needs to go and see about a situation at somebody else's house? They don't have a physical location, so they may not qualify for any reimbursement under the Main Street program. So it's not guaranteed, and we do not need to put out misinformation saying that the state of Louisiana is going to reimburse small businesses or provide funding for small businesses to respond to COVID-19, because that's not wholesale that's not completely accurate. We don't know. As far as testing is related, we know that there's a surge. There's obviously a demand. Every site that we have 150 plus people show up to be tested from throughout our parish. And so it is very important that we continue our testing and we make use as best as possible the resources that we have allocated. If we do not utilize our CARES Act funding, it's not going to go back to Washington, D.C. It's not going back to Washington, D.C. Let me say that again. It is not going back to Washington, D.C. The money will be sent to another parish, or it will be used by the state of Louisiana. Caddo Parish is in the state of Louisiana, and we should not send our resources that have been set aside to us to another parish. There's already an article that has come out saying other parishes in the state are almost maxing out on their expenses. So we shouldn't be trying to figure out how to duck around utilizing resources that we have set aside to help our residents and to help our parish respond to COVID-19. And so I want to make sure that we're not trying to do that, because the proposal that's been put before you has been vetted. It's been looked at. It's very professionally done. And the response that we get back when we're out there at the testing site, some of you have yet to come out to the testing site. Residents are thankful. They are always riding through that parking lot saying, thank y'all for doing this. We appreciate this. A car full of kids come through crying. I will never forget being at Cherokee Park, and the family came through, kids crying because they just lost a dad to COVID-19. So hopefully we will get beyond some of the rhetoric we've seen on national TV. We can't control what's out there. We can control what we're doing in response to COVID-19, the Caddo Parish way. And that's what I hope we will continue to focus on. Thank you, Mr. President.
Thank you, Commissioner Jackson. Commissioner Burrell, I got you, and then Commissioner Atkins.
I'm good for right now, Mr. Chairman.
Okay, did you want Haley to answer that question that you asked earlier?
Yes, I did.
Okay, Haley, are you prepared to answer that?
I believe what was the question again? So I had a few written down. The last question I heard was if LSU could ask for reimbursement themselves. Is that the question I'm addressing?
That's right. I kind of believe that Mr. Keble answered that for us, but obviously he asked our state to do it.
I think Commissioner Jackson probably could answer it even more so since he's dealing with this mostly. My position and what I thought I had read that it was much easier for the money to flow from government entity to government entity rather than a government entity to a private or nonprofit. That was my position.
Well, the way I is that the CARES Act does allow for healthcare providers and facilities that provide testing to uninsured to request reimbursement themselves.
Okay.
But it is reimbursement. They have to have the money up front.
We can request reimbursement from the CARES Act as well. However, we just need to be mindful that the deadline for the last expenditure is September 30th, and that means they have to have received the funding, cleared the check, and provided the parish how they spent the funds in order for us to then request reimbursement back from the state. So it's more of a timing issue for us. If we want to do it, we need to do it quickly so we can ask for reimbursement quickly.
Okay, so in other words, getting us from being a middleman to the testing would be a better situation where they can go directly to the state, I assume.
Well, I mean, there's pros and cons to both ways that you can do it. I mean, I just wanted to make you guys aware that September 30th is a hard deadline, and for us to get reimbursement, for us to claim reimbursement, we have to have the documentation for what the expenses were used for, as well as an invoice and a canceled check. And all of that has to take place by September 30th.
Thank you, Mr. Chairman.
Thank you, Commissioner Burrell. Thank you, Haley, for the explanation. Commissioner Atkins.
Thank you, Mr. President. So as I understand the current revised budget, it's roughly 270,000 in total, or up to, I should say, Commissioner Cawthorn, it's up to, correct?
Up to
272,000, 200,000, which is scheduled to go to testing, which will be managed by Dr. Keble and the LSU HSC team. Is that correct?
Yes.
And then, so there's like 72,000 for kind of PPE, hand sanitizer, signs, things like that. Can we talk about that for a minute? How is that distributed? And, do businesses request it, or do we send like care packages to businesses, or, what's the process there?
Okay. So I had two methodologies as it relates to that. Elker Bryan and I kind of briefly discussed this, but one methodology would be for the parish to handle it. And I know that the parish is kind of overrun because the parish operates as just about every testing site that is done, Caddo Parish shows up. So one methodology would be to package it up amongst the 12 districts, just like when the masks come in and we get an email from Ms. Bryant, and she says she got X number of masks and they're at the warehouse, we could be distributed to each commissioner. My thought process was to divide them up in the equal positions of 12 and have those distributed to the commissioners, and the commissioners can distribute it to their businesses. The second methodology was to have maybe a nonprofit group to kind of manage some of that for us. We identify businesses within our districts, package the stuff up, and have it distributed.
Well, thank you for that explanation. My concern on that is that there's, like, with respect to the first proposal of splitting it out between the 12 districts, I think the demand, at least for the masks, the demand has been uneven between the districts. So I'm afraid that leads to some waste. I'd rather see some sort of methodology where we have a centralized clearinghouse at the parish that people call their commissioner or call the parish, and then we send them a package or something like that. Is that something you would consider?
Absolutely, that certainly works, because we just want to make sure that each commissioner has a mechanism to communicate within their district to their business owner. And so if it makes more sense for the parish to be the central place of distribution, I'm 100% on board with that.
I think a lot of people in my district, for example, have already taken care of a lot of those needs. I recognize that there are other parts of the parish that haven't opened up as much, and they'll have needs, a need for the future. So I just want to make sure that we don't buy a bunch of stuff that the parish, that the citizens of the parish don't need. It's kind of, I'd like to see the demand pull it as opposed to us push it out there.
I got you. Not a problem.
Okay, thank you, Mr. President.
Thanks, Commissioner Atkins. I have Commissioner Jackson and Farrow, and I see Haley on the board as well. Commissioner Jackson, go ahead.
Yes. Can you hear me?
Yes, sir.
I just wanted to clarify, give some clarity as well. LSU Medical School is not a healthcare provider. I know that is something that confuses everybody. And so it's easy to get confused by that. LSU Medical School is not a healthcare provider, so they cannot tap into the hospital recovery funds that are set aside for hospitals. They are a learning institution that happen to support the mission of healthcare. They're not healthcare providers. They don't bill Medicaid. They provide medical staff for medical facilities. And that can easily get confused and get lost. And so they're a teaching institution. So there's no pool of money for LSU Health Science Center to go tap into. That is why the parish, the means by which the parish has gotten involved through this reimbursement mechanism. So I don't want anybody to think that LSU could have just gone and applied directly to the state for CARES Act funding as a quote unquote health center provider. They don't do that. The other thing is that, and I think Dr. Kelvin kind of touched it a little bit, is those higher education institutions are still trying to grapple with how do they safely reopen. And so resources and dollars are scarce. Part of the CARES, well, the thing with the CARES Act, as Haley explained, is that the expense has to be incurred. And so if you took the parish out of the middle of it, you would basically be asking LSU Health Science Center to front the cost up front, which I'm almost sure may present a challenge for them. And so these are dollars. Again, if anybody's run a business before, it's not the way you want to have to run a business. But sometimes you kind of have to make a bridge loan. There are a lot of times with my company, I have to go from my personal expenses to help kind of infuse a little cash into my business, almost like a little equity, and repay myself back once I get it up and going or get to where I need to go. I don't do that every day in my business. That's not the standard way to run a business. But sometimes you do have to move a little bit over. And when you know you got something coming in, you pay yourself back. And so what the parish would be doing in this instance is we would be reaching into our general fund or our riverboat fund to pay those dollars down, knowing that they're going to be reimbursed from the state of Louisiana. So we want to make sure that we have a clear picture on what LSU medical school is, because a lot of people can get confused and believe that they are health care providers. They provide support to our hospital system here because they are a fine medical institution of higher learning. However, they are not a health care facility. So I want to be clear about that. Thank you.
Thank you, Commissioner Jackson. I got Commissioner Taliaferro and then Young. Commissioner Johnson, were you waving your hand? No? Okay. Just wanted to make sure. And then commissioners, I want to give you guys a heads up. If we can try to wrap this up in the next 5 minutes. I know some people have to commute to get to our special meeting that starts in 30 minutes. So Commissioner Taliaferro.
Yes, Mr. President, just a quick question for my understanding and some of my constituents is that if Ochsner and LSU Health is the administrator of the funds and i.e. the testing, what's going to be the function? What's going to be the function of the 100 men of Shreveport? And, basically what are they going to be responsible for?
Okay, let me answer that question for you.
Thank you, Commissioner Cawthorn.
All right, the 100 Men of Shreveport is obviously a local nonprofit organization. As you do the testing, what the 100 Men of Shreveport have done has been the facilitator, quote unquote, for the event. So essentially, when you set up the event, you need personnel to stand up as data collectors. You need people to put the cones out, and sometimes the parish assistants us with that. Some basis of security they've been bringing in the National Guard. But that number of people that the National Guard has been sending out has been diminishing to 1 or 2, 3 people, and kind of the management of the facility. And so essentially what the 100 Men of Shreveport is essentially doing, they are the entity putting on the event, organizing the event, coordinating the event. LSU shows up, they do the swabbing, and they do the actual testing when they take it back to the lab. And then 100 Men of Shreveport has also been provided for a doctor to be on staff, for a consult, and I think Commissioner Jackson can allude more to the need for Dr. Kemp for the need for the doctor to be on staff or to be on site for the consult. But essentially, the 100 Men of Shreveport is essentially the group that's organizing and putting on the event.
Right. If I could say a few words to back up what Commissioner Cawthorn is saying, he's absolutely right. And in fact, one of the things that is important to understand, and I've been in constant communication with the National Guard, they've been absolutely top-notch and invaluable in being able to make a lot of these community testing move forward. However, many of the Guard that were deployed for COVID needs, that's going to change very soon because many of the Guard members will be reassigned overseas in the next month. So that means that the assistants to be able to actually run these sites while we're doing the swabbing and collecting all the specimens, we definitely need the 100 Men of Shreveport. They've been a fantastic group to work with and provide all of the other aspect that's needed for the event to happen that we don't do.
So one quick question, and then I'll leave it, Mr. President, is that so the last time that we gave money for additional testing facilities or testing sites, we didn't use the 100 report, nor do I remember us having to utilize another entity to provide security or logistics to actually have a mobile testing or any kind of a test. Is that correct? Is this apples and oranges?
Yes and no. Yes and no. I can answer that for you.
Steve, go ahead.
Yes and no. You did have an organization, but they did that completely for free. And that was David Raines Community Health Center. 100 Men of Shreveport came along and they volunteered as well. And so to expand what we were doing out in the communities, because you can only be at one place at one time. And so 100 Men of Shreveport came along and they started testing, and they actually put a fixed site at Galilee on every Thursday. So there's some behind the scene work, because when LSU takes the swab and they do the swab, they're going to take it back to the lab. They're going to interpret the lab, put it through its mechanism to determine whether it's positive or negative, or if they need to be retested because it's inconclusive. Somebody still has to notify. Somebody still has to take on the medical legal responsibility of notifying the patient of their results. That is not what LSU Health Science Center does. And so you had entities that have been volunteering since day one to provide that. I think some outside agitators tried to insinuate that David Raines was somehow being paid or going to make a payment, claim for payment on that, but that was not true. And so, so you have 100 Men of Shreveport that has stepped up to provide that service. And I want to encourage, if you have not been to a testing site, come out to a testing site to see the full-scale operation and world-class operation that we have. We have been the model for a lot of places in the state of Louisiana and throughout the country for rapid community mobile testing.
Okay, thank you, sir. I appreciate it. And just one further question: who certifies those people who give me my results?
That is a trained medical professional. So you heard Commissioner Cawthorn say, and don't get me wrong, your questions are very legitimate. That's why I want you to come to a site one day so you can walk through, because sometimes we can sit here and say it to you, but unless you're on site and you see it, you can connect those dots. There is a medical professional who is there. There's a doctor, there's an MD, and that MD will have an RN or an LPN or a
Nurse
MA,
practitioner.
Nurse practitioner. Those folks, they are trained. They're trained, board certified. They take on the medical legal responsibility, because if something happens wrong, they have a right to medical liability against that medical provider. And so those medical people have stepped up, and they have donated their time, their resources, and they have put their medical credentials on the line to say, we're going to do this for our community. We're going to partner with LSU Health Science Center, and we're going to partner with the Caddo Parish Commission to provide this community testing. And so it's a lot of people who have made this thing a success. It's a lot of organizations that have made this thing a success, and we've done a great job. We got to continue, because it's continue to spread, and you can best believe when school gets back in, it's going to spread more. We're going to get more spread, and that's not to stoke fear in anybody, but it's going to spread more, and we'll probably be right back here asking to re-up on testing again. Remember that we had this conversation today, but at the end of the day, I want to invite everybody who has not been to a mobile testing site, come out and see all these dots connect to each other.
Thank you, Commissioner Jackson and Mr. President. That's all. Thank you.
Thank you, Commissioner Taliaferro. I have Commissioner Johnson on the board. He hasn't spoken at all. I'd like to allow Commissioner Johnson to speak.
Yeah, it was a couple of things I wanted to ask. So with this round of testing, will that now exclude parish employees being at the site setting it up? Since the 100 men would be the ones that will be doing all of that?
Yes. Yes.
All right. Second thing too is the National Guard. I know that some of them were deployed early on for testing purposes, but visiting some of the sites, I mean, I really don't see the need to have one there unless it's something I'm missing, because most people that's coming there is in need of taking a test. So they've been cooperative from what I've seen, the ones that I've seen. So is there still a need to have National Guard?
Yes.
Because they're not there for security, not from what I've been
They're there for multiple reasons. In the past, part of it was, you're right, they can't do any security, but the presence of them basically was reassuring to everyone coming to be tested. They provided traffic flow and site oversight of the the facility and how the whole thing would be orchestrated. Their ability to command logistics was really invaluable, believe it or not. It was impressive.
And they were more on the pre-side as well.
Yeah, and so you know, we would be certainly would like to have a roll the guard, even if it's just for one or two individuals to come to maintain that that process that they employ and that they instill, because it makes sure everything goes smoothly. But you're right, we won't be able to have a large membership or a large team of the guard, and that's what the group of the 100 Men organization can help provide.
Yeah,
And we
over the
don't
last
cost for a
couple
National
sites.
Guard either.
Okay. And then my last question. Did I hear a motion on this, or we just started talking and discussion?
There's no motion, Commissioner.
Yeah, we started talking because we had
right.
Dr. Kevin.
I just wanted to know.
Sorry.
Okay, I just wanted to know because I missed it if we had one.
All right, well, we're
I'm
going to
done.
go for the motion right now.
Thank you,
I'm
Vice
done.
President. I got Commissioner Young, and then I see Commissioner Jackson back to the board. Go ahead, Commissioner Young.
Thank you, Mr. President. I wanted to follow up on my understanding of perhaps a consequence of Commissioner Atkins' suggestion about the parish having a clearinghouse. And I'm wondering if that is going to require, well, I'll just speak for myself. Would that sort of scenario maybe require me to contact businesses in my district to see if they want the kits that we're putting together? What
absolutely.
would be expected of a commissioner?
Well,
if
obviously we can post it on the website. We can post it to the community. But of the commissioner, you can make contact with businesses in your community.
Would I be sort of the only person moving on that, and I should and I would need to do it, or do you think are we planning for other avenues by which most businesses would get this information, or do I need to be the one who pushes it to them?
It could be three-pronged. We can put it on, like I said, we can put it on the parish's website. We can make some public notification through our communications officer, and then thirdly, the commissioners themselves can let their constituents in their district aware that these supplies exist.
Okay.
And the parish itself will be the clearinghouse.
Okay, thank you. That's all, Mr. President. Thanks.
Thanks, Mr. Young. Haley, I still see your hand up there. Did you want to address? I guess you already answered one question. What's going on?
Well, I just wanted to point out as it relates to the small business COVID kits. In preparation for this ordinance being on the agenda, I reached out to my contact at the state who does all the approvals and so forth of my reimbursement request. And she indicated that the program for small businesses would be reimbursable, but we needed to make sure that the program and how the businesses are chosen to receive the small kits is very well documented. So I raised my hand to let you know that this can't be just, I'm going to give business A something, business B something. We have to have a criteria that the business must meet before they can receive it so that we can be reimbursed. So that's why I wanted to let you guys know that you can't just give 12 packets to each commissioner and let them give away as goes. It has to be a designated reason and it has to be certain criteria that you guys choose. It just has to be documented. And I just didn't want y'all to pass this without me telling you that piece of information. So sorry for it.
Thank you. Haley, can you send us a guideline of that we have before Thursday so we can address that?
Sure, I'll do my best. Yeah.
Okay, thank you. All right, Commissioner Jackson, if you can yield for one moment. I see Commissioner Watts on there. She has not spoken. Commissioner Watts?
Thank you, Mr. President. I think Haley just addressed my question. And I think you just asked for, I'm sorry, I have an echo. Can you hear me? Hello?
Yes, we can hear you.
Okay. Yeah, I wanted to ask what type of criteria so that we're setting the standards for small businesses.
My contact did not give me exact criteria. She just said that y'all had to set the criteria. So I could reach out to her to see if she perhaps could give me some examples if some other areas have done this. But she just said it had to be a well-documented program.
Haley, can I?
Yeah, I think, yeah, because
Go ahead,
thank you, Haley. I think that all businesses are gonna meet, an urgent need at this time. So I think we need to know that. I know that this has to lay over for a couple weeks anyway. With that being said, is that something, Attorney Frazier, that we can make amendments to on the latter end?
If you're going to, basically, all we're doing today is moving it to Thursday, and then the public hearing and final passage will be 2 weeks from Thursday, so it would be amended at that point.
Okay.
Okay.
And the second portion to that, since it's just moving to Thursday, I do not have to abstain today, or do I need to abstain as well today for the legislation that includes Oshner LSU Health?
You would probably want to abstain all the way through, Commissioner, if it pertains to Oshner.
Okay. Thank you. That'll be all, Mr. President.
Thank you, Commissioner. I see Commissioner Jackson took his hand down. I show no other commissioner.
No.
Commissioner Jackson, you're the last. If you wanted to make a motion or speak.
Yeah, I want to make a motion to move this proposal forward to Thursday.
Second.
All right, got a Commissioner Jackson make the motion to move to Thursday, second by Commissioner Cawthorn. I see no one on the board. Commissioner Jackson, you want to speak on that?
I will say that I think our amount is very low. And I just want to note that I think we run the risk of probably having our funds being redirected to another parish very soon. But I'm going to support this because I understand the crucial nature of continuing the testing and getting those supplies and PPEs to businesses. The clearinghouse, I think that there was an entity that I thought applied to help us kind of manage, just kind of wholesale manage COVID-19. So I want to support this right now, but I just think that it's sort of a piecemeal approach, but I get it. Some people are not ready to go that far, that big right now. So I'm not going to argue with that, but I hope that you would give some thought. And I hope that we would not allow our resources to be sent to another parish or to the state of Louisiana. Because again, the money is not going back to Washington, D.C. It's going to be spent in the state of Louisiana. I would hope that we would try to spend as much of it as we can reasonably and responsibly in Caddo Parish. We may not never have a need for all of it, but the ones that we know we have a need for, we would spend it in Caddo Parish. Thank you.
Well said, Commissioner Jackson. Thank you. Mr. Everson, roll call vote, please.
Can I clarify first? There was a long discussion there, and I just want to make sure I understood the motion correct. From the context, it sounds like that motion was to amend to the reduced amount, that revised budget.
That's correct.
Yes.
Is that correct?
Yes.
Okay, so this is advancing to the next agenda, an amended version of 5967 with the new budget. Just for clarity, I wanted to state that. Okay, Commissioner Hopkins.
Yes.
Commissioner Johnson.
Yes.
Commissioner Jackson.
Yes.
Commissioner Young.
Yes.
Commissioner Burrell.
Yes.
Commissioner Cawthorn.
Yes.
Commissioner Gage-Watt.
Out of an abundance of caution, I'll be abstaining due to
Thank you.
employment with Oshner LSU Health.
Thank you for the explanation. And Commissioner Taliaferro.
Yes.
Commissioner Atkins.
Yes.
Commissioner Chavez.
Yes.
Commissioner Lazarus.
Yes.
And Commissioner Epperson.
Yes.
All right, that motion does carry with 11 in support and 1 abstaining.
All right. Commissioners, be safe. We'll see you at the chamber.
Well, we do have one more item on the agenda. Is 5.7, the authorized resolution number 58 of 2020, a resolution electing to hold meetings pursuant to section 17.1 of Title 42 of the Louisiana Revised Statutes and otherwise providing with respect thereto.
Mr. President, if I could speak on it about it very briefly, I could just describe it a little bit and then stop speaking.
Sure, absolutely.
Okay, so I asked for this resolution to be drafted at a time when I thought we were only going to be able to meet in person, and I knew that I couldn't be there. Because I think that Commissioner Burrell agreed with my position, I asked him to present it. It says what I wanted it to say, but not in the clearest possible way. The whereases in this document say that for various reasons, COVID is a serious threat, and we think that we shouldn't meet in person because there are multiple levels of guidance that suggest that in-person meetings of 12 people or more, or 10 people or more, are risky, and there's more than that of us. And that therefore we shouldn't have in-person meetings, but should only do virtual meetings in accordance with the law. However, I would certainly be open to discussing this and changing it to request the state legislature to allow us to meet by Zoom as we did before, since the medical situation doesn't seem to have changed. And I think that we're doing an exemplary job of running the parish's business virtually for now. And I think that sets a good example for the public as well. That's all I wanted to say about it.
Well said.
Since it's my, Mr. Chairman.
Yes, sir. Go ahead.
Since it's my piece of legislation, I have my name on it. I'll make a couple comments. Since we introduced this resolution, I don't know if you're familiar, but in the building where we're supposed to meet, on today, I got information that there's been more of an outbreak in that building, that they may have to shut it down and clean it. I don't know if you're familiar with that yet or not. On the 5th floor, there's been an outbreak, and on the 8th floor, there's been an outbreak. And given those facts and the fact that some of us can be compromised, you as the president has some jurisdiction in as it relates to this Act 302 to keep us safe. That is the reason why I directed my comments to you more so than my fellow colleagues, because it specifically says, as I understand in 302, that you have jurisdiction in this to either make a decision as to whether or not we will meet virtually or not meet virtually based upon safety precautions. I'm just giving you some additional information or cover if that's what you need. In addition to that, other information, as Commissioner John Paul just said, that the White House itself has said that they didn't recommend meetings for groups of 10 or less. That's coming from the White House of all places. And then you have this piece of legislation being that is coming out of the Senate. No reflection on my fellow colleagues, but it's a super majority Republican Senate, and I know that they will march in step with those that on a national level. But we are local. You have a responsibility for us, and I hold you to that responsibility for me and mine. And from that perspective, I would like for you to exercise your leadership authority to keep us safe and not put us in a situation that we already know, based upon information that has come out today, that the building is basically contaminated as far as I'm concerned. So I will not be, with all due respect, showing up and putting myself at risk, because I do have a family and I care about them more than politics. I'm sorry. So that's my position, Mr. Chairman, Mr. President.
Well heard, Commissioner Burrell, and Donna, Attorney Frazier. It's my understanding that we can have Zoom meetings, but it can only be of an emergency nature. Is that correct, or have I misunderstood that we can Zoom everything?
Commissioner, I think I've sent the email in response to your question earlier this morning. Act 302, which is now 42:17.1 of the Public Meetings Act, allows 3 categories of items on agendas for virtual meetings. And so the items on the agenda have to fall within one of those 3 categories.
Okay, so we are forced to meet in person if the items on the agenda do not fall within those 3 categories, correct?
That is correct.
Okay, I understand. Commissioner Brown.
Well, I don't know about force, Mr. Chairman. Nobody gonna force me to meet no damn where. I'm gonna tell you, tell them to come and arrest me because I'm not gonna meet based upon my own safety. There's no one that dictates to me my welfare and my livelihood. And those are the 2 things. If that means decommission me, I'll be the first to be decommissioned, Mr. President.
I will be writing a letter to the governor as well as seeing if we can put some legislation to urge the state to make an amendment to that. Commissioner Brown, I hear you loud and clear, and as the president, I'll do everything I can to adhere to your safety. I can guarantee you that, so I'll be working on that.
I'd like to be recognized.
Commissioner Epperson, go ahead. You have the floor. You have yet to speak at all.
I too heard about the, I think the 5th floor. I understood there were 5 or 6 persons that had tested positive. And now on the 5th floor, and they're now here on the 8th floor. If memory recalls me correctly, I think we had 1 or 2 people that tested positive on the 8th floor of the commission, and we shut down and decontaminate the whole business. I sent out an email asking for a response, and I do not see that I've received an answer up to this point in time.
Yeah.
Is that true? What's the situation?
Hey, Commissioner Epperson. This is Dr. Wilson, sir. I've already responded to your email earlier today, and there's no outbreak on the 8th floor, but we are in discussion with the city because they did have a floor dimension that had some positive cases come up.
Okay, so what does that mean?
That means there was no reported outbreak on the 8th floor, but there have been several cases on the floor you mentioned previously in your comments.
Okay, so what happens now? When there was an outbreak on the 8th floor, did you shut and completely decontaminate?
Yes, sir, we did that, and it's my understanding, and the reply I sent to you back earlier, I was told by the city that they were going to only address the 5th floor.
We paid for the entire building when we had to break out. Am I correct?
Yes, sir, that's correct. You are correct.
I mean, but what's the situation now?
Hey,
I don't understand.
I'm all right.
I can't.
Yeah, they're gonna do it at 5:30 now.
I can't speak to the situation, sir, other than we have to continue to observe all the cautionary measures that we have going and coming out of the building, where you must wear the mask. It's my understanding that more vigilance is being given to disinfecting those common areas and also the door handles and door knobs that we all touch as we go back and forth. So I think that's to the extent of what's being done.
One other question, Mr. Chairman.
Give me one moment, Commissioner Burrell. I wanted to make sure Commissioner Epperson is complete.
I'm finished.
Okay. I have Vice President Johnson, then Young, then Jackson, and I will add Commissioner Burrell onto the list. Commissioner Johnson?
I want to know who is going to be the person to interpret the agenda items to determine whether it meets those 3 criteria.
Attorney Frazier, will you take that question, please?
Commissioner, I believe the presiding officer, which would be your president, is going to have to sign the certification, certifying that what is on the agenda meets those categories of items. So he would need to be more comfortable with it. I can provide legal advice, but I think I've included what my advice is in the memo and told you what I would need if I had to go to the court and defend one of those things. And so what I would tell you is anything outside of what the act says and what I've told you I need to effectively represent a court case, is probably something maybe you should consider not putting on the agenda. If you've got what we need to be able to successfully defend any of the actions, then that can, go forward as far as I'm concerned.
Well, the reason I asked that question is I know that on the 3:30 agenda, we have something about with the NGOs of funding some of those. And I think one of the criteria is if it presents a hardship. Am I right or wrong?
One of those criteria is if it presents economic hardship or severe economic dislocation.
Right. So basically, if those organizations don't get that money, it's presenting them with a hardship, in my understanding. Am I right or wrong?
Let me just take a look at something here.
And Vice President, in regards to her answer, if you'd like, I think it'd be advantageous if you and myself sat down for the future meetings and pick those items together. I don't think anybody could go wrong with bipartisanship, and you and I working together on that. We could bring Commissioner Atkins too.
I support that.
Thank you, Commissioner.
But Commissioner, I guess to answer your question, I was wanting to take a look at, because I'm not certain if it deals with, let's see, curtailment of vital public services or severe economic dislocation and hardship. So I guess what you would need, or what we would need to provide in regard to those, is whatever other resources they would have to continue the services that they provide, the necessity of those services, whether those services can be provided only by those organizations, or if there are other organizations providing the services, and those type of things.
Okay, so and this is what I guess stresses me out about us sometimes. The smallest of the small, and that's talking about dealing with nonprofit organizations, and a lot of them are neighborhood nonprofit organizations. I'm not talking about the larger ones. We asked them to basically get blood out of a turnip before we even allocate them some money. Or basically to allocate them some money. And so, a lot of them don't have a lot of resources or additional people there to help put all this stuff together. And so it takes up more time to do that. And it seems as if we're just putting things in front of them so that they would say, well, I don't want food with the parish, and because they're going to always put some obstacle in front of me that wasn't there, and then put another obstacle in front of me. So it's basically this abundance of paperwork that they didn't expect and wasn't there when they initially applied for the application. But then other ones can come along and, not say nothing at all, and we give them money and nobody say nothing. So I just wanted us to get more consistent on what we do. That's all. And I think we had another deal in there about too. There's another one that is a gray area that could basically go on anything that we do. I mean, if it talks about quality of life and some other thing that's on there, I forgot what it was, but I think that one can fall under mostly anything we put on the agenda. It depends on how you interpret it.
I think the problem with that one is, in addition to being critical to continuing the commission's business. I think you're talking about number 3. You got to have a legal requirement or other deadline. It can't be one or the other. It's got to be both. So you've got to have a deadline in connection with in order to deal with that issue under the Act 302.
Okay, so that again, the NGO, they got a deadline. They got to have a deadline in order to get the money. They have a deadline in order to turn in reports. So they have deadlines, and so it depends on how far deep you want to dig to do each subject. That's all I'm saying. That's all I got, Mr. President.
Mr. President.
I have Commissioner Young, then Jackson, then Burrell.
And
Epperson, add you back on there. I'll add you. I'll put Epperson after Burrell. All right, Commissioner Young, you have the floor.
Thank you, Mr. President. And I want to thank Commissioner Johnson also for his comment, which I thought was insightful. I personally would like to amend this resolution to urge the state legislature to allow us to meet by Zoom on any topic as we were before.
Chair will that.
Thank you. May I speak about it also?
Absolutely.
So my reason for that is that I think that the medical circumstances are the same or perhaps slightly worse. I don't think that there is any evidence that we're excluding the public from our deliberations. I think actually we're more open to the public than before because it's much easier to watch us from home than it is to drive to a central location. I think that we have exemplary participation from both the commissioners and the public through their comments during our Zoom meetings. I think that this is a great way to conduct government, and I'm very happy that we have this option during a contagion. And I also think that this law either allows us to do whatever we would do ordinarily, according to Commissioner Johnson's interpretation, or limits our ability to govern in an unreasonable way that lacks a rational basis. And if it does limit our ability irrationally, I would like to challenge it in court. Thank you.
Amen.
I have Commissioner Jackson, Burrell, then Epperson, and I see you, Dr. Wilson. You're on the board as well.
Yes, sir.
So we got Commissioner Jackson. You have the floor.
You muted.
Will you unmute Commissioner Jackson?
All right, there I am. Can you hear me?
Gotcha.
I actually would like to tack on an amendment, whatever this resolution is going to be, that we would seek to file a legal motion in federal court, because I think that's my amendment. If I can get a second, I'll speak to it.
I'll second.
I think that this violates the voting rights of individuals who have elected local officials to represent them. You got folks, this is the same thing we dealt with voting. That's why you have the federal courts upholding mail-in voting, mail-in ballots. That's exactly why they're upholding it, because you have people who are going to be put at risk. And if they are exposed, or if they have high risk, then they can't participate in the process. Individuals who know that they're high risk, or individuals who have comorbid diseases, should not have to put their life on the line to come do their job. And if you're telling me that we are being bound to meet under these circumstances, and you have at least 3 or 4 people who are saying, I can't come down there. Look, I'm not about to do a funeral and memorialize people when we don't have to. I'm not going to do that. I'm not looking for anybody to be a martyr here. We don't have to do that. We can follow simple science and be smart. The legislature seemed to have a point to prove in trying to exercise their muscle and their strength to the governor. I don't want us to get in the middle of that. I want us to use sound judgment to make decisions. Clearly, this legislation didn't even take into account whether there's an outbreak in the building that conflicted with our meeting times. Because if you're telling me 6 people have tested positive. That's 6 people that have been on the elevator. That's 6 people that have walked through the doors. There's 6 people who use the restroom. You can't tell me that it's only limited to 6 people. And Dr. Wilson, Erica,
Yeah.
I think y'all need to be having a conversation with the city about closing that building down and sanitizing. We should not wait until people put us on blast. Okay. Even if it hasn't, even if nobody on the 8th floor right now is not showing symptoms, we need to take an abundance of caution. Because if I understand it, the only way you can get to your floor is by pressing a button or by touching the keypad. So we're not in a touchless environment. We need to take the necessary precautions. And I'm not going to disenfranchise the district, the folks in District 12 or District 7. Is that Burrell 7? They shouldn't be disenfranchised. Now, I feel that I'm healthy. I can come down there and I'll be fine. But we should not be disenfranchising these other districts simply because they cannot make it down there. And I think that that violates their voting rights of their constituents because they will not have equal and fair representation. And I think the law on its face violates the United States Constitution. Thank you.
Thank you, Commissioner Jackson. Commissioner Burrell, then Everson, Dr. Wilson, and LBJ.
Yes.
Well, Mr. President, again, Commissioner Jackson just touched on what I was going to touch on, and that is, if you got an outbreak on the 5th floor, how in the devil are you going to retain it there on the 5th floor? These people move around. We don't have these kind of walls and fences that separate us like we do in our politics. And again, you know, I can make a decision for myself and my family. I don't need for you or anybody else to make a decision for me. I made that clear. What really concerns me is more and more on a national level, what is being sent down to our states and our local government that it appears that we are being forced to follow. I just read on and looked at several stations where there's a report, and I ask you to do that too, to come out to look at a report from Vanity Fair that has just come out stating that national testing was restricted or eliminated. There was a national testing movement that was put together for national testing of COVID, and the president's son-in-law, Mr. Kushner, was put in charge of it, and he eliminated it based upon the strategy. Now listen good, based upon a strategy, a partisan strategy that says that they felt that there would be more Democratic states and more Democratic cities that would catch COVID than it would otherwise. Now, to me, in my opinion, in my observation, that is like genocide. Someone being in control of genocide. Now, maybe you may not take it that personal. I take it personally. And what's so ironic about it, and I'm gonna finish, what's so ironic about it is the fact that he's Jewish. And if anybody should know about genocide, he should know. But politics has taken this thing to a whole different level that none of us have seen. So I don't trust any of them, Mr. President. And I'm telling you, I'm trying to keep my composure where I can still have trust in our local government and our local politics. But it's getting very, very thin on this end. And I can assure you of that. I normally don't, you know, because I'm not really afraid of much of anything, but I am afraid of things that I don't see or can't see. And I can't see this virus. And there's no telling where I may pick it up. But I'm going to live as long as I can live, because I do have families that I have to take care of, Mr. Chairman, and I'm gonna leave it at that. Thank you very much.
Yes, sir, Commissioner Burrell. And again, as I mentioned before, I'm gonna do everything I can to ensure your safety. I can't speak on what's going on nationally. I don't even hear about that.
But it affects us all.
Yes, sir. Real quick, Attorney Fraser, is there a set deadline of an expiration time? Whereas we called a meeting at 3:30 for a chamber meeting, that if we do not meet at that specific time, that we forfeit our allocation for that meeting. Are we okay to continue with this meeting and then directly enter in our other meeting with a given recess?
Commissioner, you're off. You often, well, not often, but we've started meetings late in the past. I think as long as somebody is there to notify the public that the meeting, the 3:30 meeting is still scheduled at this time, you're fine.
Okay, Mr. Everson, please let any public citizen that enters the chamber, let them know that we're still in our current special meeting that's running over, and then we will be in the chamber momentarily.
Yes, sir. We actually just did that a moment ago.
Thank you. All right, Commissioner Epperson, you have the floor.
Dr. Wilson, are you going to request reimbursement for the percentage that we paid to disinfect the entire government plaza?
Yes, sir. We did.
Okay.
We submitted that cost.
This is just one question I have. How can we justify that we had an outbreak on the 8th floor? We disinfected the entire facility.
Yes, sir.
And you have an outbreak of multiple people, the way that I understand of what I heard, and you're just going to disinfect the 5th floor. That does not make any sense at all whatsoever, sir.
Yes, sir.
None whatsoever.
We will address that with the city, sir.
And I would certainly support the motion that we would file a suit immediately relative to the situations and the concerns that we have expressed here after our legal staff put it in proper context and move forward. And I will be supporting this resolution.
Yes, sir.
Commissioner Epperson, does that conclude your comments?
Yes, sir.
Thank you, Commissioner Epperson. Dr. Wilson, I have you on the board.
Yes, sir. I think it's been made quite clear that we don't have an outbreak on the 8th floor, but we will immediately get with the city of Shreveport and see what we can do to remedy the situation, put everybody at ease with respect to what is currently going on with the facility.
Thank you, Doctor.
Point of information, Mr. Chairman, before we leave Mr. Wilson's comment.
Yes, sir.
Mr. Wilson, we did have an outbreak on the 8th floor initially. Am I correct?
Yes, sir. Early on, we did.
Okay, and we disinfected the entire building.
Yes, sir, we did.
All right, thank you.
Okay.
Commissioner Vice President Johnson, you're next.
Thank you, Mr. President. Basically, I wanted to say that we're overlooking one of the major things that which we are elected to do, and that's public safety. You know, if we meet back into the chamber, then we're expecting the public to come down for public comments and come into Government Plaza, which they could infect us, we could infect them, we don't know. Ain't nobody took a test within the last 5 minutes, so don't nobody know if they have the virus or not. There's no way to know whether someone is asymptomatic. Just because they don't have a fever, they can still have the virus. And by doing Zoom, individuals at home or in a place in which they are, and it's more safer for the public to be there than to be in Government Plaza. We've had many public comments, either by the phone or by emails, that they've called in and kept the public safe by introducing everybody into the Government Plaza, into the chamber. Now we're going into a bit of unknown. I've talked to a city councilman, council person, and basically they went into the chamber last week and they're gonna be fighting to get back out of the chamber because they have one person that underlying condition. And then, you know, why would you expose that person to that underlying condition? We have two with us. So why would we want to expose those 2 or 3 to that same kind of scenario? I think, you know, public safety is thing that we have to look at and abide by. We're taking care of the business of the parish. There's nothing that's been dropped or not covered by doing these Zoom meetings. And if you look behind me, Caddo has 281 deaths and 38 new cases just for the day. So that was reported for the day. So it's a 7.5% daily positive. That's what we got going on in Caddo Parish right now. So we need to flatten these numbers out, and going back into that is not doing it. And just as well as starting school and having kids go into the schoolhouse will not do it. Thank you.
Thanks, Vice President. Commissioner Watts, you have the board, or you have the floor, sorry.
Thank you, Mr. President. I just want to reiterate some of the sentiments that I've heard over the last 30 minutes. I do believe that we all are very aware of the insensitive comments that has been made about us meeting, first of all. Second of all, I think when we say that we can contain something like coronavirus to a small area, then we're not being true with ourselves. We know that none of us have any blueprints on how to handle COVID-19. We also know that people entering that building, there could be litigation against us for that if they are infected and can prove that it happened in Government Plaza. The best thing for us to do is to make an executive decision and to stay out of that building and discourage anyone else from entering that building until it is cleaned properly. It's just like having a building with gasoline around it, waiting on someone to come by with a lit cigarette and flick it out the window and catch on fire. We know that's not a safe environment, and it is our job. We're obligated to provide a safe environment for everyone who enters those doors. So I too agree with the resolution that has been proposed, and I do believe that we need to enter into litigation about this. Whatever we need to do to have this discussion openly, legally, it needs to happen. And Government Plaza needs to be closed today. Thank you.
Thank you, Commissioner Watts. I see no other commissioners on the board. I'll interject. I guess I'll see what the legal types up. I'll vote on passing this till Thursday, but I want to see what it says first off in regards to us opting into litigation with the state. I don't know. I'll be cautious with going down that route, but ultimately, commissioners, your safety is my first concern. So, like I said,
I'm sorry, point of clarification. At this point, we will have a resolution typed up that will need to be added to one of the agenda Thursdays to vote on.
Right, and that's okay. Thank you for addressing that. That was my concern. I wanted to see what the verbiage said before I could vote on that to pass, but I'll definitely share the concerns of my fellow commissioners to vote on it, to move it to Thursday. Mr. Everson, roll call vote, please.
Okay, and just to let y'all know, we do have a caller who called in for public comments and is holding. So after you wrap this, you may choose to hear that. But the motion that we have right now was a motion by Commissioner Jackson, seconded by Commissioner Epperson, and I'll start the roll call vote. Commissioner Hopkins.
Wait, what?
Read the motion.
What are we voting on?
We're going to vote on the original motion, Commissioner Jackson, as amended to urge the state legislator, coupled with your amendment, to have the legal department draft something in the regards of a resolution.
Can you restate yours, Commissioner Jackson? I have it written down, but for clarity, I want to make sure you.
Yeah, I just wanted us to, I don't know that we have to draw up a resolution. I asked that legal be tasked with, and I guess I get what Attorney Frazier is saying is we have to have a formal action. Is that what you're saying, Attorney Frazier? A formal action asking you all to file the suit? Is that what you're saying?
That is correct, Commissioner.
Okay. So yes, my motion is to, at this point, have legal get back to us with legal proceedings to challenge this law in court, in federal court, specifically in federal court, because it violates the voting rights.
Okay, is that, are we clear?
Yes.
Great, okay.
Is that an addition? Is that added to the agenda item, or is that a separate item? I'd prefer it be.
Added to the amendment.
All right. Well, you're escalating a lot.
Sorry.
Okay, so Commissioner Jackson's amendment would be to the advancing of asking the governor to allow us to meet via teleconference. So this is a motion to advance this to Thursday's agenda. So we will add this amendment into it as well. Okay. I just want to make sure we're all clear and ready to vote.
You clear, Mr. Jackson?
Yes.
Great, thank you.
We can change it on Thursday for the final vote. I'll get with Attorney
Correct.
Bernstein and we can change it.
Thank you.
Commissioners, just to make sure that it's clear and to clarify, what the amendment, as I understand it, is Commissioner Jackson is asking legal to get with the commission or provide what is necessary for us to take legal action. And so that's all that's being advanced right now. There will also be a resolution presented to you for you to add to the agenda to actually take that action at that time.
Thank you for that clarification. Okay, are we ready for the roll call vote?
Yes, please.
Commissioner Hopkins.
No.
Commissioner Johnson.
Yes.
Commissioner Jackson.
Yes.
Commissioner Young.
Yes.
Commissioner Burrell.
Yes.
Commissioner Cawthorn.
Yes.
Commissioner Gage-Watts. Didn't hear a response from Commissioner Gage-Watts. Commissioner Taliaferro.
Yes, I'm sorry.
Commissioner Taliaferro, what was your response?
Yes.
Okay. Commissioner Atkins.
No.
Commissioner Chavez.
Yes.
Commissioner Lazarus.
No.
Commissioner Epperson.
Yes.
Okay, that motion does carry with 9 in support and 3 in opposition.
Thank you, Mr. Everson. I had a couple commissioners still on the board. I had Commissioner Jackson and Commissioner Atkins. Commissioner Atkins, go ahead, and then I'll get Commissioner Jackson. Well, hold on a second, guys. Mr. Everson, do we still have a citizen waiting?
I believe we do.
Okay, commissioners, if you can yield for
I think
1 moment.
mine was an accident.
Oh, okay. I'd like to allow the citizen to make a comment while they've been holding, and then Commissioner Atkins will have you if that's okay. Okay, go ahead, Mr. Everson. Bring them on.
Thank you. Deputy Clerk, can you connect the caller, please?
Hold on 1 second. Hello, Mr. Michaels. Okay, I'm going to put you on speakerphone. You're going to state your name, then you have 3 minutes to speak, okay? Okay. You might want to mute your computer also because there's feedback. Okay, and I will put you on speaker. Go ahead when you're ready, sir.
Hi, I don't know what the usual topics for discussion are, but I do believe that I have something important to speak about concerning patient safety. All this information can be verified too, and I'll give you the where if you're verified, or you can message me afterwards to get the link to the site. In the past, there was a petition so that the patient abuse and cover up at LSU Hospital, the patient abuse, that stopped. That was like 8 years ago. The thing is I've tried to get help with the patient abuse. I know people who have been torture victims. I've tried getting help from Ochsner health systems. They block people who complain about patients who have who are victims of staff abuse, and Mayor Perkins blocks victims who complain about staff abuse, and City of Shreveport government on the Facebook page. They all block this. Speak up, say something about abuse. Now, I've documented all of these things with extensive screenshots, and I've got a conversation between me and Sheriff Prater, where you can tell that he looks at the complaint in a private message, and he doesn't answer. Claim is done by Caddo Crime Stoppers, okay? And both of Crime Stoppers block victims of staff abuse at LSU Hospital. The thing about it is, I mean, dude, I can show y'all like 500 and plus communications concerning that. And Adrian Perkins, the mayor, is trying to emailing him. Oh, it's a few things. None of the emails actually elicit any response concerning police brutality, okay? And not only that, the Shrika Fields, and this is very important, Shrika Fields, the chief financial officer, that is a falsified contact information on the directory at caddo.org. So, with that being said, Shrika Fields is a financial officer. That's taking away citizens' ability to, make inquiries about funds. And I talked to Casey Brown about this, which this is all on record and documented in case anybody wants to hear it, about, the information at Shreveport.gov being fixed because it's not right for citizens to be redirected, to emails that don't ever respond. I've also, there's this citizen named Angela Hamilton. I thought Adrian Perkins, which I can show you the email, screenshot or whatever, but it's blocked Adrian Perkins via email. And I think, it's bad enough
Mr.
that
Michaels.
they're blocking people on Facebook.
Mr. Michaels.
Extensively.
Mr. Michaels.
Yes, ma'am.
I don't mean to interrupt, but your 3 minutes is up.
All right, that's good. Did that record? Will my voice, will that play after I download this video?
Yes, sir.
The Caddo Parish video?
Yes, sir.
Okay, thank you. Thank you very much. I'll go back to listening.
Okay, you have a good day.
Okay.
Bye-bye.
Thank you, Deputy Nations. That Commissioner Atkins.
Thank you, Mr. President. Someone's not muted. There we go. I'd like to be supportive of my colleagues who are uncomfortable attending meetings in the council. I understand those concerns. I think they're legitimate. And for those reasons, I haven't said anything contrary during this meeting. I believe that a couple of well-placed calls to the governor or well-placed emails or letters could probably get this resolved. He could probably write some sort of executive order to allow us to meet via Zoom. So I'd be supportive of that, although I'm not supportive of filing a federal suit. That just seems to be a bridge too far too soon to me. So for those reasons, if that resolution comes up with a component to file a federal suit, I'll vote no. But I want you guys to know that I'm supportive of trying to find a way to conduct our meetings that you all are comfortable with. So just wanted to convey those thoughts. Thank you.
Mr. Chairman.
Atkins. Yes, sir. Commissioner Epperson, I'll add you right after Commissioner Jackson.
Okay.
Go ahead, Commissioner Jackson, you have the floor.
Yes, I just want to say that I believe that those olive branches have been extended before, and I don't necessarily know that this is an issue that we are taking up with the governor. I think this is an issue that where the legislature tried to clip the governor's executive order. This was part of their attempt to sort of, I guess, work around. I don't know. I did not see the debate. I'll go back and watch what debate was on it. But seeing that it does not take into consideration what happens if there is an outbreak in our building, there's completely no consideration for what happens if our building becomes contaminated and we have to shut down as we're dealing with now. Then how do we meet? So it seems like it was put through to kind of take away some powers and duties away from the governor. And I guess in his compromise, he probably didn't want to push back or things like that, because now that there's a law on the books, I don't know, Attorney Frazier, I don't know if he can suspend the law through executive order.
Actually, Commissioner, in Act 302, it states, I believe that if the governor continues certain parts of his proclamations, that meetings held in under that part of the governor's proclamation would not be considered to be in violation of the act.
So you're saying he can insert that?
That is my reading of it, yes.
Okay, so I mean, we can continue to petition. I guess on Thursday, now that we voted, I guess on Thursday I'll access to at least have the police jury make a formal request on our behalf, as well as LMA. But
They've already done that.
Right. I was about to say, I know we've asked before.
Yeah, they had several
Yeah.
organizations. Several organizations have gone to the governor, and he would not. He did not rescind it. I just want to throw that in.
Right. So I know that that's been done. I mean, but this was something that the legislature chose to do. So our issue is that, you know, we've got people who have been duly elected to represent folks. And if they can't participate in the process that they've been duly elected to participate in, then somebody's being disenfranchised at some point. And, you know, I know it's kind of out there, but at some point we got to get clarity on what we're doing. So, but I think we've got to start the ball somewhere and having some serious conversations. So I don't want it to be seen as a slight at the governor, nor necessarily the legislature. I'm more for making sure we are doing things and making rules and policies that are in the best interest of everybody and given all of the possible scenarios that are out there. Thank you.
Thank you, Commissioner Jackson. Commissioner Everson, you have the floor.
Mr. Jackson, I think the motion the motion for the resolution that we have on the floor is sufficient. We have gone through those avenues, LMA, Police Jury Association, School Board, and we've been rejected. It appears that other people have no qualms with filing a suit against things that we do. And I'd also like to make this quite clear. I know all of my constituents know me, and probably many more people. I can take care of any business in my district or that the commission put on the table via Zoom or whatever, from my office, by computer, by cell phone, landline, fax machine, or desktops, which I all have access to. No problem whatsoever servicing my constituents. Matter of fact, I take care of a lot of issues that are state related. Some people don't even know who their state representative or their state senator is. Don't even know their responsibilities. And I have been doing my job as commissioner probably before some of them was still in high school or something, before they were even elected. And I am quite capable of handling any situation that arises among my constituents in this current process that we are undergoing through Zoom. And I don't need anyone telling me how to handle my business. Thank you.
Thanks, Commissioner Epperson. I agree with you. A lot of people don't even know their own state rep. I can assure you that nobody in Greenwood does not know Commissioner Epperson now. That's definitely a household name. And if Commissioner Epperson can handle the Zoom, I'm with you. I believe everybody can handle the Zoom and do these meetings from wherever respectively and safely. I have no other commissioners on the board. Mr. Everson, we've already voted on that. If I can get a commissioner.
Motion to adjourn.
The chair will second. Commissioners, we'll take a slight recess. It's 4:07, so Mr. Everson, let them know that we'll commence or we'll start at 4:30 in the chamber.